Thank you very much and welcome everybody. We've had a very successful two-day meeting. We've covered some very important topics, very much public health orientated, the issue of childhood obesity, the issue of the tobacco situation in Europe and the need for a smoke-free environment, particularly to protect our children. We've also addressed the impact of the financial situation around Europe on our health services. And there was great concern amongst the ministers on the Council, on the Member State Council, in relation to this and the need for an input to the finance ministries on this issue, and a greater need for more closer cooperation, because there is a point at which there can be tremendous downside for our economies if health services are reduced beyond a certain point. And that's not to say that all ministers weren't acutely aware of the fact that there is a need for greater efficiencies, and that what we should seek to do is to cut the cost of service, not the service itself. So we also had a session that was hosted by Minister White on the issue of patient safety, and then under any other business there was the issue of securing supply for APIs, as they're known, allied pharmaceutical ingredients, which are important for the making of pharmaceuticals here in Europe, many of which are manufactured outside the EU, and to ensure that there's product safety there. So those were the main issues. I believe we did make some progress. The Commission have agreed to take some actions in relation to childhood obesity, one of the sessions of which was chaired by Minister Francis Fitzgerald. Can I just come back to the issue? Well, just start by saying that there's a study in Europe which shows that for every extra year longevity, you increase your GNP by 4%. So ergo, each year of longevity lost has a negative impact on your GNP. And whilst we spent a lot of time yesterday on childhood obesity and the very serious situation that's evolving right throughout Europe, whereby we are now seeing type 2 diabetes in teenagers, something that when I started my medical career you only saw in adults in their 50s and 60s. We really do run the risk, if we don't address this, of being the first generation to bury the generation behind us. And prevention is better than cure, and we know how to take action around this, and there are lots of strategies being developed to deal with that. But something that is so much clearer and so much more obvious is the fact that we have 700,000 Europeans dying every single year from tobacco-related illness. 700,000. It's a staggering figure. And we know that the tobacco industry have to replace those 700,000 every year. And we know that, as the Commissioner has said, 73% of people surveyed who are smokers said they started smoking under the age of 18. They are focusing on children. And that's why this directive is so important. And here's something I didn't see until I went to Europe. This is advertising. This is a packet, and I'll block the brand name on it. But you can see that this is like a perfume box. It's attractive. It's a nice colour. It even has the name of a leading fashion magazine on it. And there's 20 slim cigarettes in this. That's what they're trying to attract our children, particularly young girls, to smoking. And what this directive will mean is something what we've done here ourselves, but right across Europe it means people will see the reality, not the advertisement. And that's what smoking does to your lungs. So the directive is critically important. We know that 1 in 2 smokers die from a tobacco-related illness. We know that's 700,000 Europeans, and here in Ireland it's 5,200 Irish people. And we have a duty of care to protect our citizens, to save lives, and in particular, to shield our children from this killer habit. And I think that's why we have appealed to those countries in Europe who have tobacco industries who obviously will feel an economic impact from this, to go with the directive. Its effect will be slow to come to play, number one, and number two, why we want to engage with financial ministries and ministries of industry and jobs is to encourage countries and the EU to support countries who are involved in the tobacco industry to focus their energies into other industries that don't have such catastrophic consequence for the consumers of their product.